SoundBytes from Vet Advantage. This SoundByte is sponsored by Merial and focuses on PREVICOX PREVICOX, help for dogs in pain associated with canine osteoarthritis, and the PREVICOX Select program. Important safety information. As a class, cyclooxygenase inhibitory NSAIDs may be associated with gastrointestinal, kidney, or liver side effects. These are usually mild but may be serious. Pet owners should discontinue therapy and contact their veterinarian immediately if side effects occur. Evaluation for pre-existing conditions and regular monitoring are recommended for pets on any medication, including PREVICOX. Use with other NSAIDs, corticosteroids, or nephrotoxic medication should be avoided. Refer to the prescribing information for complete details or visit www.previcox.com. Please refer to Merial's SoundByte Tear-Out, published recently in Vet Advantage magazine. At the bottom of page 2, we help you start a dialogue with your customers. Start by asking, "Doctor, has anyone talked with you recently about PREVICOX PREVICOX as a good choice for your canines that need relief of pain and inflammation associated with soft tissue and orthopedic surgery and osteoarthritis?" If they say yes, then you can assume they have some understanding of the product. Be sure to confirm the benefits. But if they say no, you become the primary person to discuss the product. Using a confidence statement and an invitation to engage your customer will allow you to review the features, functions, and benefits of PREVICOX. Present yourself as being confident about the solution you're about to share, with something like, "Doctor, I'm confident PREVICOX PREVICOX, the NSAID designed specifically for veterinary use, provides fast-acting, safe control of pain and inflammation associated with OA and soft tissue and orthopedic surgery." Then invite your customer to align what you know about PREVICOX PREVICOX with what your customer knows. A neutral invitation sounds like, "Let's review the key benefits of PREVICOX." To seek the level of decision the customer is willing to make, continue with, "So you can decide if PREVICOX PREVICOX is right for your client's pets that have pain and inflammation associated with soft tissue and orthopedic surgery and osteoarthritis." Lead your customer to review the benefits and brand values represented on the SoundByte. This will reinforce customer knowledge of the brand and uncover any concerns. Start by discussing the features, functions, and their benefits. Focus your customer toward key decision elements and use the SoundByte as a sales aid to help guide the conversation. Starting with features, you might say something like, "PREVICOX PREVICOX is a coxib class non-steroidal anti-inflammatory drug, NSAID, developed specifically for veterinary use. It's approved to control the pain and inflammation associated with OA and orthopedic and soft tissue surgery. It's available in 2 sizes as flavored chewable tablets. PREVICOX is rapidly absorbed following oral administration and detected in plasma after 30 minutes. PREVICOX inhibits the COX-2 enzyme." Then describe their function. PREVICOX PREVICOX has been developed to alleviate the pain and inflammation associated with canine osteoarthritis, OA, and to reduce pain following surgery. PREVICOX is to be given once a day with or without food for canines diagnosed with osteoarthritis and once a day for up to 3 days with or without food for orthopedic and soft tissue surgery in canines. Peak plasma levels are reached within 90 minutes and PREVICOX maintains inhibition concentration levels of 50% for a full 24 hours. And then describe the benefits. This dog-designed formula acts fast to relieve pain and potentially improve the mobility of dogs with OA. In previous safety studies, no statistically significant increase in bleeding times or clotting profile variables were observed in treated dogs versus untreated controls. PREVICOX PREVICOX is convenient for pet owners and provides practical dosing for DVMs. Same dose rate for all label claims with no age restrictions. PREVICOX is safe at recommended doses. Rapid absorption and COX-2 inhibition for a full 24 hours. PREVICOX inhibits COX-2 while sparing COX-1 enzymes, which help maintain the homeostasis of GI, renal, and platelet function. Clinical relevance has not been determined. Use page 2 of the SoundByte to review frequently asked questions about PREVICOX PREVICOX and the Select program. As you can see, SoundBytes will help you have more meaningful conversations with your customers. Our Go Deeper section addresses the most prevalent customer responses. Stay with us as we model a more in-depth conversation. Or contact your Merial rep or visit www.PREVICOX.com. One of the 4 types of responses your customers may present when you go to close a sale is what we call a complain response. It could sound like this. With all the NSAIDs on the market these days, I'm struggling to know how to be in the best position in the category without carrying 7 or 8 different products, which, for the most part, all do the same thing. It's just plain hard to decide anymore. Here's a great way to handle that complaint. It can be difficult to decide when there are many choices available. Tell me what's important to you in an NSAID, and then let's look at how PREVICOX Virocoxib matches up with your priorities. Another type of response is what we call avoid. I tried PREVICOX Virocoxib after it came on the market, but we never could tell much of a difference over the other NSAIDs we use. What else do you have for me today? Here's a great way to handle a response like this. What specific improvements were you expecting when you tried PREVICOX versus the other NSAIDs? Would you be willing to try PREVICOX again on your next 5 patients with OA or after surgery? Or your customers may present what we call a stop response. Something like, the Merial rep was just in last week and we went through the PREVICOX Virocoxib information for about 30 minutes. You would have thought PREVICOX was a new drug or something. Let's not talk anymore about NSAIDs. Here's how to keep the conversation going. It sounds like you're comfortable using PREVICOX in your NSAID protocols. Is that correct? To be sure, are you taking advantage of the Select program rebates and savings offered by Merial on PREVICOX? Finally, your customers may respond with what we call a challenge. You know, PREVICOX Virocoxib has worked just fine for me when I use it. However, I do not choose Merial flea tick and heartworm products as my first choice. It always feels like I'm paying a premium for PREVICOX, so I've just stopped prescribing it. Show me the economics of PREVICOX. Here's a great way to handle this challenge. Fair enough, let's look at the economics of PREVICOX using a cost per dose approach. The reason to look at per dose cost is to adjust dose to the size of the dog, as some dogs might not need a full tablet. For example, you may get 120 doses for the price of a 60-count bottle if prescribing for a 15-pound or a 70-pound dog. Merial also provides a Select program which offers rebates and savings for you. Please see full prescribing information. Also, you can view a copy on www.PREVICOX.com. As you can see, SoundBytes help you have more productive conversations with your customers. But don't take our word for it. Try it and find out for yourself. It works. Important safety information. As a class, cyclooxygenase inhibitory NSAIDs may be associated with gastrointestinal, kidney, or liver side effects. These are usually mild but may be serious. Pet owners should discontinue therapy and contact their veterinarian immediately if side effects occur. Evaluation for pre-existing conditions and regular monitoring are recommended for pets on any medication, including PREVICOX. Use with other NSAIDs, corticosteroids, or nephrotoxic medication should be avoided. Refer to the prescribing information for complete details or visit www.PREVICOX.com. Thank you for your time, and again, contact your Merial rep or visit www.PREVICOX.com.